today. I made a few slides, so please let me share them. Please, can I be heard?
Yes, loud and clear.
Okay, thank you. Dr. Albert, before I start, I just want to say thank you for this opportunity to continue to educate people on psychiatric conditions in the country. Please, can we see my screen?
Yes, very beautiful slides. Put it in presentation mode.
Yes, please. Are we in presentation mode?
Yes.
Okay. So it's a very short presentation, like Dr. Albert mentioned. It's very straight to the point. Today we are talking about postpartum depression. Like he said, it's not something that a lot of people talk about. It's actually more common than we think. So first, we'll start with what postpartum depression is. What are these big words that we have put together in the first place? So I broke it down a bit. So post means after. Postpartum, post-meal, just means after. Then partum in itself is a Latin word, which means childbirth or delivery. So normally we say intrapartum, postpartum, prepartum. We are just talking about the delivery, the labor, and then childbirth. Then what is depression? A lot of us like to use depression to mean a lot of things. When we are sad, when we are tired, when we are stressed, we say we are depressed. But depression in itself is actually a medical condition which affects our mood and our emotions. So typically it's characterized by the presence of persistent feelings of sadness, persistent feelings of low mood, persistent feelings of being overwhelmed, a decrease in energy, and lots of interest in previously enjoyable activities. Things we used to like watching football, we used to like watching telenovelas, we used to like going out, but we have lost interest in these things for at least 2 weeks or more. That's when we say that you are depressed or you have depression. Why at all are we talking about postpartum depression today? Like Dr. Albert mentioned, it's a very important topic for us to discuss, and it's actually quite common. It occurs in at least 1 out of 7 women who have had children. And it's very important because it affects the relationship between the mother and her newborn baby or her infant. Postpartum depression affects breastfeeding, the ability to breastfeed, and sometimes can also result in inability or failure to breastfeed. Typically results in negative parenting practices. So the child is often treated very negatively and inappropriately, and this affects how your child will develop both physically and psychologically. It's been shown that children born to mothers who have or had postpartum depression have been found to show changes in behavior and abnormal social interactions. That is how they form friendships, how they keep relationships, all of that. And early onset of depressive illness. So if your child, unfortunately, if you have postpartum depression and we don't manage it properly, your child also has an increased risk of developing depression. So this is why we need to look at postpartum depression properly, because it doesn't just affect you, the mother, it affects your relationship with your child, and it also affects your relationship with your partner or spouse. So what is postpartum depression? Another term we use for postpartum depression is postnatal depression. Natal just means as usual, after birth. So this is where you have the presence of signs and symptoms of depression, like we talked about earlier, the persistent feelings of sadness, the persistent low mood with a decrease in energy, and then the loss of interest in things you used to enjoy. Over here, these symptoms occur for at least 2 to 8 weeks. They occur about 2 to 8 weeks after you give birth, and sometimes even within the whole year after childbirth, they are present. So the problem here is that the symptoms are persistent and they cause significant distress. They really affect you, the mother, when you have these feelings, and then they affect your ability to take care of yourself and your child. At this point, that's where we need extra help and intervention, because they affect how your relationship with your child, they affect how you feed your children, how you relate with your child. and even how you take care of yourself. Lots of the time, apart from the mood symptoms I talked about earlier, there are also feelings of intense fear and worry for your child, about your baby, about how you'll be able to take care of your baby. And these feelings tend to impair your ability to take care of your child and yourself. And there may also be intrusive thoughts about harming yourself or your child. I mean, just because you have the thoughts doesn't necessarily mean that you act on them, but they are very distressing. You have had a child, it's been barely 2 months, but once a while or once or twice a day, you get thoughts about what will happen if I did this to the child or I harmed the child. And I can imagine how distressing that must be for anybody who's having those kind of thoughts. So what does postpartum depression look like? So like we said earlier, feelings of sadness, feelings of low mood, or being just generally overwhelmed. And there may or may not be persistent crying. And these feelings don't go away. They are there every day. They are there all the time. And nothing you do can take them away. You look at your child, you don't feel any joy. You look at your child, all you can think about is how overwhelmed you are and how overwhelming the whole situation is. You can't seem to find any bright days. Then it's a problem. Obviously, it's not everybody who has a child that is very excited or feels the immediate bond. There's that, and that is not unusual. But ideally, within the first 2 or 3 weeks, and there should have been some form of bond formed where ultimately, even if you're not totally excited all the time, you do have moments where your child brings you joy, or you have moments where you are joyous about something. So if you don't have any moments like that where you feel numb every time you look at your child, every time you have to do something for yourself, then it's something to worry about. If you find that you're unable to enjoy things that usually or normally brought you pleasure, then that's also something to worry about. I talked about basic things like watching football, playing football, watching TV. Some people, even the fact that they can sleep and wake up is enough to bring them joy. But you find that you don't get enough rest anymore. It's problematic. Here, I need to mention that having a newborn is it's in itself, it can be very overwhelming and it can be exhausting. So when I talk about feeling overwhelmed here, I mean that apart from the tiredness of it all, the thing is that once now, as we go through the process, you tend to adjust. What you feel after 2 weeks is not the same you feel after day 5. Or what you feel after week 3 is not the same. But if you notice that it's a pervasive feeling of overwhelmness, you are always tired, you don't have energy. So you don't even have energy to take care of yourself, to get out of bed, to take a shower, to make a plate of food for yourself, let alone to be concerned about if your child has eaten, to be concerned about breastfeeding your child, to be concerned about if your child has been able to take a shower, if your child is healthy. All these are red flags that we need to pay attention to. Do you realize that you have a poor concentration or attention span? So you can't sit down to make decisions or even plan your day. Or let's say you know that you have to, you know that there are certain things that you have to do in a particular way. But these days, you realize that you can't concentrate to see things through. You can't concentrate. You start something, by the time you realize your mind is somewhere else, what you should take 30 minutes, 45 minutes to do is taking about 2.5 to 3 hours. Then that's a red flag. That's a thing that you should worry about. It also looks like low self-esteem and self-confidence. Yes, in the first week, in the first 10 days, you're always sure about how to handle your baby, what to do, what is right, what is right, what will not make your baby wake up, what will help your baby with sleep, has your baby eating well, is your baby still breathing? All these are issues that come in the early days. But ultimately, day by day, we tend to gain confidence in ourselves. Because if you're able to feed your child, put your child to sleep, you know that you feel a sense of accomplishment. So if you realize that even after about 2 weeks, 3 weeks, 4 weeks postpartum, post-delivery, you still are not too confident in your ability to take care of yourself, you're not confident in your ability to take care of the baby, you don't believe in yourself. So when they are bringing you the baby, you're very afraid. You don't know how to carry your child, how to support. Yeah, it's not like you don't know how to carry the child per se, but you are afraid. Even though this is something that you have been doing, you don't have confidence in yourself. So it's not something that you even want to do. You don't want to touch the baby. because you're not confident. You don't believe in yourself, even though this is something that with people around, the support you've had, you've been able to do. But yeah, day in, day out, it's a problem for you to do because you just don't feel confident. You don't feel worthy of doing such a thing. That's what postpartum depression can look like. Then there's a step sleep. Here, people will say that, oh, yes, but if you have a newborn baby, you have a new baby, sleep there is a problem, yes. But ultimately, even when your baby is asleep, if you're having difficulty sleeping, then it's a problem. If you realize that your mind is racing everywhere, you are tired, you know you're tired. So why are you not sleeping? Your child is asleep. Yes, it feels like you can't rest your mind. You're thinking. That's a red flag as well. Other changes in your appetite. You are breastfeeding, so obviously you'll be hungry. You are using a lot of calories, you're using a lot of body resources. So ultimately, ideally, most people who in the postpartum phase tend to eat well. Some people say they even eat more because the child is taking some more from them. So here, if you notice that you don't have any appetite, you're never hungry, or you want to eat the whole day, you drink a box of Calipo, one Coke, that's it. That's problematic. And that's not how it was before you had the baby. That's problematic. If you feel detached from your baby or your partner, like I mentioned earlier, obviously, so there are some people who, because of how the pregnancy happened or how delivery or labor went, they don't immediately bond with their children. And that's normal, that's fine. But through the daily activities, through the breastfeeding, through having your baby, sometimes eventually a bond forms. So if you are still struggling to bond with your baby, if you feel like you don't have any particular bond, you're not in sync, if you feel detached from your baby, or even your partner, throughout all this, lots of the time in the early post-delivery stage, that's when lots of partners bond because they have created a life and it's a new responsibility and they tend to fall on each other for support. But if you feel a bit detached at this point, maybe you should start looking at other things around you and you should start looking at the other symptoms to see if yes, are you really depressed or you are not? Then, like I mentioned earlier, having intrusive thoughts of hurting yourself or your baby. It's not something you want to do. It's not something that brings you joy. Just keep having these strange thoughts about what if my baby dies? What if I do this and my baby dies? Those kind of thoughts that keep coming, you can't seem to control them. They are distressing and they affect you even holding the baby because you're afraid that if you touch your child, what you are thinking you will do. All these are red flags that would point to postpartum depression. At this point, I want to talk about about postpartum blues. It's a similar condition to postpartum depression, but it's less severe and it's actually very, very, very more common than even postpartum depression. Postpartum blues occurs in about most mothers. Every 3 out of 4 mothers has postpartum blues. So what's postpartum blues? So this is when you have temporary mood symptoms that starts maybe the day after you came from hospital with the baby. It lasts for about 5 to 10 days, maximum 10 days. But these things resolve on their own. So here you are very anxious, you are tearful, something small and you're crying, you're having difficulty sleeping, you're feeling overwhelmed, you're feeling a bit anxious. Any little thing can make you upset. And all of this, you're worried about taking care of your child. If you're able to take care of your child, it's all centered around your child. It's not an unusual thing to have. And it's expected really because obviously if you not had a child before, you are totally unsure about how things are going to go, if you'll be able to be a good mother, or if you'll be able to take care of your child properly. So, and also because of the exhaustion, the lack of sleep, because you're also adjusting to your baby's sleep pattern, your baby's eating pattern. And the fact that around your whole life is the baby, it's a baby, it can be difficult, but it's not unusual. Typically, a lot of the time, because socially we have a lot of good support, once the midwives talk to you, once you are able to take care of your child for a few days, your anxiety lessens, you figure things out, you're okay. You're okay. So after about 5, 6, 7 days, really after about a week, most of these things resolve and you're able to continue. So with postpartum blues, yes, they spontaneously resolves. It's not unusual. It happens. It's a typical psychological reaction. Like yeah, you have a new child, you don't know what to do. So will I be able to handle it? And then you learn that you can handle it, and then you move forward. All those things resolve. So the problem with postpartum blues is that sometimes they can be severe enough to progress to postpartum depression. So here I mentioned that the symptoms are temporary. Once you get the hang of things, the symptoms disappear. But if you are struggling to get the hang of things, you're still feeling like this, day 7, day 10, day 14, now we're in week 3, it's no longer postpartum blues. You are entering the territory of postpartum depression, and you need some help and support with regards to how to go forward and how to ensure that you can care for yourself and your baby. So what are the causes of postpartum depression? Why do some people get postpartum depression, and why do others not get postpartum depression? The first thing we need to understand is that typically with all mental health conditions, they occur because of an interaction between who we are as individuals, our biological makeup, and what is happening in our brains at the time and what is happening around us. That's what will predispose you to getting postpartum depression. That's what will predispose you to getting maybe postpartum blues. That's what will predispose you to getting some form of mental disorder. The thing with postpartum depression is that typically our hormones, pregnancy involves a lot of hormones. And as soon as you deliver, everything starts to change. The aim is to bring you back to pre-pregnancy state. And it can be a very fast process for some hormones, a very slow process for others. And depending on what is happening with you or around you at the time, all these factors influence whether you develop postpartum depression or not. So for example, if you are somebody who has had depression in the past, right? And now pregnancy happened, and for certain reasons you have difficulty coping, you can develop postpartum depression. If you have a family history of depression, an aunt who was depressed at some point, a mother who was depressed at some point, a sister or a cousin who was depressed at some point, pregnancy is the postpartum is a stressor, it's a trigger. It means that you have a biological makeup to probably have depression at some point. But because you have never had any kind of stressor or trigger for depression, you have been okay. But at this point, the postpartum period here could be a stressor or a trigger to then let you develop postpartum depression. Then things like older age of having a child, sometimes as we grow older, we are a little less, we are a little less resilient. Things that are a little less adaptable. Things that as younger people, if they are happening to us, we're able to brush it off and move forward. But as we grow older, it becomes a little more difficult to do that. So in that instance, it's that's a trigger or a stressor for developing depression. And being a single mother, here there are lots of issues going on. If there's no social support, the anxiety throughout the pregnancy about what happened post-pregnancy, all these things can influence whether I develop postpartum depression or not. If the pregnancy itself was unwanted, it's a huge stressor. You have gone through a pregnancy where you didn't want to go through, and now you have a child that you didn't necessarily want. That alone in itself can influence our emotions and our mood in the postpartum period, where all our hormones are haywire. Then we also have ambivalence towards the pregnancy. So this one is not necessarily that you didn't really want the pregnancy, but you didn't want the pregnancy anyway, but it has come. So, I mean, let's just move with it. It's not something you're looking forward to, but in the end, this is it. It's also a contributing factor, because mentally you might not necessarily be expecting to deal with all that is happening in the postpartum period. And now all of a sudden, this is where you are and this is what you have. And it's not something you were looking forward to initially. So that in itself is a stressor, a contributing factor to developing depression. If you have a poor relationship with your own mother, in this instance here, obviously now you're a mother, and all the things that have happened in your past sort of tend to influence how you look at your new relationship with your new baby. And it can be a positive or a negative thing. So in this instance, that in itself can be a trigger to developing depression. If you have poor social support, you don't have any external family who can help you out, your husband is not in the country, or you don't even have a spouse in the first place, it's just you and your baby. You're not necessarily financially solvent enough. You're not necessarily financially solvent enough with regards to this baby. So in terms of how you feed the baby, what you guys will use to eat because you're not working, all these things contribute to our mental states in the postpartum period and can make us depressed. And there's also a history of sexual abuse where there's a lot of fear that what happened to you can happen again and can happen to your child. And so I talked about the intense anxiety and the fear and the worry. And so this influences how you see your baby, how you relate with your baby, and generally your emotions surrounding having the baby in this period. Then if you have a difficult pregnancy and delivery, so for example, throughout your entire 9 months of the pregnancy, you were on bed rest for at least 6. The last month, there was a lot of bleeding. Delivery itself was difficult. You were not sure your baby would survive or not. All these things are stresses and triggers for postpartum depression because now that you have your baby, it's been a stress response that you have had throughout the entire pregnancy. And so there are some issues with your biological response and even your mental and emotional response to the baby. Some people, it can be a sense of relief, and some people, it can just be a sense of further stress or distress that after all that we have gone through, there's still no peace, there's still no, and you realize that you're having difficulty bonding with your baby. All these things can contribute to having postpartum depression. So how do we manage postpartum depression? There's a lot of stigma with mental illness in our country, in our society. And so sometimes it's difficult for people to, you can't just necessarily, imagine having intrusive thoughts about hurting your baby or the fact that you have not been able to bond to your baby. You don't feel that kind of love and joy that everybody's talking about. And it's a difficult thing to admit to yourself and to even communicate to someone else. But the only way you can get help is if you speak up and you seek help. So in as much as all this is going on, you need to realize that you are not alone. If you know somebody who is struggling like this, you need to let the person realize that they are not alone. And that postpartum depression is actually more common than you would think. One in seven pregnant women, it's actually not a very large number. I'm sure a lot of us know more than 10 or 15 people with children. So that means that at least maybe half of them, one person at some point was struggling with this. So you need to let them understand that they are not alone and that they are not to blame for what's going on. It's not their fault that they cannot bond with their child. It's not their fault that all this is happening. Like we said earlier, it's an interaction between who you are, what your parents have given you to form you, and all that is happening around you. And so you are really not to blame for what is going on. And all you need is some extra help. Unfortunately, some people need some help. Some people don't need help, but you with some extra, you just need a little help to help you get better, to help you take care of your child, and to help you take care of yourself. So in seeking help, who can you talk to? You can talk to your midwife, you can talk to your obstetrician and gynecologist. You can also seek, and depending on how bad it is, you might need to seek some form of medical or psychological help. The thing about talking to people is that if you were going through postpartum blues, talking to your midwife or your doctor, it's solidly enough to help you feel much better about where you are and about where you are in your childbearing phase and about what is going on around you. And talking to people makes you realize that you're not alone. You know, there are other people who they have seen who have struggled just like you. And it also helps you to know where to get help from. Because when you talk to others, they're able to direct you to other healthcare workers, they're able to direct you to where exactly you can get the best help so that you can take the best care of yourself and your baby. So when you have to seek medical and psychological help for postpartum depression, typically you would either benefit from medications and or talk therapy, where you see a psychologist and then you talk through what exactly is going on and how best or what coping strategies you can develop so that you can take care of yourself and your baby. Also, spousal support is important. If in the initial stages you are struggling with taking care of yourself, taking care of the baby, a lot of the time, just the fact that you know that you have someone to support you emotionally, someone who can support you also psychologically and physically. So where you know that you are struggling with feeding your child, or you're having sleep issues, you know that your spouse is there to take up the slack and can feed the child while you get the rest that you need. All these things are important. Then lifestyle changes. We tend to not consider these as important, but these are very, very important regular things we can do that help us to cope with the stress of having a newborn, with the stress of having changes in our lives. Basic things like making sure that you eat regularly, you eat at least 3 times a day, things like getting in physical activity and exercise. These things help us, they give us a new outlook to life because exercise has a biological response there. When you exercise, you release happy hormones. When you eat, you release happy hormones. And regular sleep. I mean, here somebody will ask that you have a newborn. How can you have regular sleep? So this is where spousal support comes in as well, where you are having difficulty because you're always exhausted. I mean, if for one night or even for a few hours, your spouse can handle the baby while you get some extra hours of sleep, it makes the biggest difference in generally just how you relate to everybody and how you see things and how you think about things in the next few hours when you are awake. It's also been shown that exclusive breastfeeding has a positive effect on reducing depressive symptoms from childbirth after about 3 months. So here, breastfeeding, we take it for granted, but breastfeeding helps you to bond with your baby. So if you know that he or she is fully relying on you for food, and so every 3 to 4 hours, you have to pick up your baby, you have to cuddle your baby, make sure baby gets enough food. It's a way of bonding with your child. Because ultimately, while they are feeding, it's not like their eyes are closed. It's not like you are distracted. You are paying attention to your baby to make sure that they are getting all they need and they are getting and they are breastfeeding properly. So this is a way of increasing bonding. Because once you increase bonding, once your relationship with your child improves, it tends to also improve how you feel. Because one of the reasons why you are so overwhelmed and sad is because you don't see the reason, or you don't see any, what's the word? Don't see any effort, or you don't see any reward in what you're doing. But once you're able to bond, you tend to feel better. It was a very short and succinct presentation. So at this point, I'm done here, but I'm open for any questions now.
Thank you very much, Dr. Lorna Latte. I actually appreciate the fact that you honored the invitation. I know how busy you are, especially during these times. We appreciate your straightness, going straight to the point. Now, the fact is, this condition is actually far, far commoner than we think, especially the postpartum blues, and of course, the postpartum depression as well. Just not too long ago, I had a private patient who, after delivery, 7 months straight from delivery, she's gone to about 9 different hospitals. And this particular diagnosis was missed by everyone at every level. But the symptom was there, because the way she was presenting wasn't the typical way of postpartum depression. She was talking about this, talking about that. But very classical was the fact that she had lost interest in taking care of her own daughter. No mother does that willingly.
Yeah.
So we all need to know this. Just like she's taking us through all the symptoms, we all need to know this so that if there's somebody around us, somebody we know who is having this condition, there is help available. Dr. Lorna said 1 out of every 7 women suffer it. So it's quite common, very much commoner than we think. So the essence of this channel is to become the hub of specialist medical knowledge, where if somebody wants to know something about a particular medical topic, when you come to this channel, you are likely to find that topic having been dealt with already. So we've had an amazing presentation. People on YouTube are excited about it. I'm also excited about the things that you're sharing. If any of us have any questions, Mr. Osepuk, we have a question. Please drop it in the comment section in the chat box, and Dr. Latte will gladly handle the response to every question you might have. If you have any question, drop it in the comment section. Okay, so somebody is saying he's surprised how such an important information is not made available during counseling services during antenatal clinic. A close friend's wife was going through it and we did not know. Thanks for the information. Yes. And Dr. Latte, how common it is. It is very, very common. You may not know, especially if you are not looking out for it. Okay, so it's good. The good thing is those who join late, the presentation will be loaded on the YouTube channel. You can have your time. It's just a few minutes. Go listen to it again. You can be of help to somebody in your church, at work, or at home, wherever. You know, knowledge is potential power. All right, thank you very much. If anybody has any question, Dr. Lorna, everyone is appreciating your efforts. Everyone is talking about great presentation, great presentation, great presentation.
Thank you very much.
Yes. Do men also suffer from postpartum depression? Good question. Thank
So
you very much.
actually, I found out something. So there's something called paternal postnatal depression, where men are also struggling to adjust to the fact that there's a baby in the house, and I mean, hours have to change, responsibilities have to change, priorities have to change. So it's not in the main literature, but it's a new thing that is coming up. So also, if you know any fathers who are having difficulty adjusting, please, there's help for them. Okay, it's a new thing.
Yes. We have to consider it because Charlie, the changes the man has to make, the responsibility doubles about 10x. Buying diapers. Some fathers complain that when they see their kids who are to change their diapers, the kids are poo-pooing, they become angry because they know they have to buy more diapers to replace it. When they see the kids eating, they are angry because they know they have to pay for that. So Charlie, everybody needs help.
Yes, everybody does.
Yes. Okay, so somebody is asking, what's the difference between postpartum depression and postpartum psychosis?
So postpartum depression is primarily a mood disorder. So here the main issues are, like I said, the sadness, the low mood, the inability to enjoy, the lack of bonding, and then the low energy, the poor concentration. But with postpartum psychosis, there are florid psychotic symptoms. So psychotic symptoms here mean hearing voices, believe that their life is in danger, inability to trust other family members or people around them to take care of their child, believe that their child's life is in danger as well from people around them. There might be some mood symptoms with postpartum psychosis. You might also have a little of these depressed symptoms, but here the major thing will be the abnormal or the unusual behavior, who you know a person to be in terms of what they believe and what they understand. It's not necessarily what you are able to get. It's not necessarily what you see when you or hear when you interact with them. Then there's also the increased agitation, restlessness. They can't sleep, but in their not sleeping, it's not because they are tired. There's a lot of energy and they are walking up and down, trying to do other things that don't necessarily benefit the baby or themselves. So that's where we bring in postpartum psychosis. I hope that helps a bit.
Yes, so thank you very much. So psychosis simply means you're losing touch with reality. So postpartum psychosis is after delivery, the mother is losing touch with reality. So thank you very much, Dr. Lorna Latte, for an amazing job. Anyone has any other questions? Somebody wanted to briefly go over how to manage the situation. Just briefly go over that for the person.
Okay, so the first step I said was we have to speak out. That it's difficult for you to tell people that you are having thoughts to harm your child. It's difficult to tell people that you are struggling to take care of your child because you lack the energy to even wake up to feed them. You lack the energy to make sure your child has taken a bath, to care that your child is well. That the most important thing is that if you are having thoughts like this, if they are feeling like this, let people around you know that this is what you are going through. That's the first step. Obviously, then the second step would be now to talk to a healthcare practitioner. Ideally, because your first point of call healthcare practitioner would have been like your midwife, your OBGYN, you would communicate these feelings and these problems to them. And if it's not something that can be handled in the clinic session immediately, like postpartum boost, they would refer you to seek further help from either a psychiatrist or a psychologist. But as Dr. Albert mentioned earlier, sometimes it's difficult for healthcare practitioners to even be able to determine that this is what the problem necessarily is. So if you feel that you're having intrusive thoughts of harming your child, you're having mood issues immediately after delivering or even up to a year, please seek the help of a psychiatrist or a psychologist. And there we can intervene and help you feel better about yourself and about your baby.
Thank you very much. Thank you very much. All right. Anyone else have any question?
Okay. There's another question in the chat.
Doctor, do we have specific foods that should be avoided in depressive situations?
Well, no. Food is good for the body. That's why God made it. And I mentioned earlier that one of the things that you can do to help yourself is, in terms of lifestyle changes, is to eat regularly. Normally, we don't realize it's about one of the symptoms or one of the signs of hunger is irritability. That's easily angered. They say a hungry man is an angry man. That is exactly what that phrase means. We're not necessarily very patient, and we have difficulty concentrating when we are hungry, and we generally don't feel good about ourselves and about things happening around us when you are hungry. All foods are good to eat when you are hungry, and here emphasis is on actual food, like food you can hold, fruits, vegetables, carbohydrates. Food here is not soft drinks. Food here is not beverages. Food here does not include alcohol. All those things are not food. Specific foods like food, like things you put on the stove and then you can make to eat.
Yeah. Thank you very much. Thank you very much. So there are no specific foods to avoid. Yes, speak out, seek help. There is help available. Very importantly, psychosocial supports where you have somebody to help you. That's where your mother, the grandmother of the child, is very important. Your spouse, your husband is very important. If you have other people to also help you. If you have sisters, very, very valuable in such situation. Most often than not, the postpartum blues resolve on their own because of this great support system that we have mostly in Africa, but we are losing that support system gradually. So if you're on this presentation, you've heard this amazing presentation, you can all tell that Dr. Lorna, Dr. Latte has done a great job. You can help share the recording when it is shared to your friends so that they can also have the signs and symptoms, so that if anyone needs help, you know who to talk to. Like Dr. Latte said, most often than not, it's quite difficult for the person to tell the doctor or to tell somebody that I'm having thought of harming my child. It will not make sense to them. But this is a very common symptom we get in the hospitals all the time. The mother will tell you, I feel like throwing my child away. I feel like killing my child. I feel like harming my child. It's real and it's far commoner than you think. So if the awareness is out there like that, you can help us. Social media, you can share it to people to watch, and always, always, always remember what Dr. Latte said: speak up, speak out, seek help, because there is help available. If anybody else has any question, please put it in the chat box, put it in the comment section. We have a few more minutes to go. It was very concise, precise, straight to the point. I enjoyed every bit of it. I'm glad everyone else who joined us live also enjoyed it. Our friends on YouTube and Zoom, questions are allowed. Few more minutes to go. Dr. Lorna Latte is available. We are so grateful that she made time for us, even though during times like this, she's very, very busy. Very, very busy. So we appreciate her sacrifice to come share her knowledge with us. Someone is asking, are there any long-term effects if this situation is not properly managed?
Yes. So one of the risk factors of having postpartum depression is the likelihood of developing, I don't want to say chronic depression, but I mean, depression can resolve on its own in the long term. It takes about 2 years. But obviously, if you're not able to deal with this properly and it's resolved, there's a likelihood of developing another postpartum depression again when you have another child, or even in life in general, you can have more depressive episodes. So that's a long-term risk that you have to look at. Another thing is in terms of your children and your relationship with your children. Postpartum depression affects how we relate with them, and it affects how we parent our children. And this will ultimately, unfortunately, affect their psychological development going forward. So it also kind of increases their risk of developing depressive illnesses as adolescents, children, and as adults. So these are all things we have to look for. This is why it's important to pick it up early so that we can at least put in interventions to prevent all this from happening. Another thing is that postpartum depression, once you develop postpartum depression, you have the risk of developing other types of mental health illnesses later on. I mentioned that another risk of developing postpartum depression. We have another condition called bipolar disorder, where you have inability to regulate your mood. So you are either on the extremes, very high or very low. And once you have one episode, you have the risk for developing that kind of disorder later on in your life. And that's when I say the risk, it doesn't mean that it will happen. It means that there is a chance, albeit small, but it's possible.
Thank you very much. That was a very good question and a great response. Just to reiterate what Dr. Latte said, if the mother is going through postpartum depression, it's very, very dangerous, because that mother will not be able to give the best care to the child. That means that the care for the child is not going to be adequate, and the child is going to lack certain things, and that child is going to also suffer at a higher risk of also developing depression even earlier and other mental health illnesses. So you see, the ripple effect is quite too much. So prevention and seeking help early is the way to go. Of course, she said it. Once you've had one that is not properly treated, you can have another one. And once you've had this and it's not properly taken care of, you can develop other mental health conditions as well. That is why we are trying our best to up awareness creation. And you can help us get and reach more people with this good news. Now, somebody is asking a very important question. Doc, those women who abandon their children in the bush, in toilet facilities, are they suffering from postpartum depression?
That's a tough one. There are lots of contributing factors to why these things happen. I could say that one of them might be postpartum depression, but there are also a lot of contributing factors. Poor social support, unwanted pregnancy. I mean, there are lots of things that could influence why a mother would abandon their baby if they didn't want the baby in the first place, but also if they are not able to bond with the baby, if they are having postpartum mood issues, it can be a contributing factor as well.
Yes, so she's rightly said it. Single parenting is not an easy thing. It's not at all. Most people may do that not because they are wicked necessarily, but yeah, they may be having postpartum depression or postpartum psychosis, or they may also have lots of other constraints in their life. Somebody may say, throw the baby away and continue with my life, to travel out the country or to go to school or to, a lot of factors account to that. What is key here, Dr. Latte has said it severally. She mentioned at every point of the management is psychosocial support. Taking care of a newborn baby itself is quite stressful. This afternoon, I was at a friend's office. The wife is going to school, so the man has to take care of the baby, and he kept complaining, and I kept reassuring him that he should just enjoy the journey. He should just enjoy the process. So it's quite a laborious activity. So everyone who is taking care of a newborn baby needs help. So if you have a friend who's giving birth, you give a helping hand, because it can be extremely overwhelming. Thank you very much, Dr. Latte, for such a great response. Any last question? As we have some few more minutes to go, Dr. Lorna Latte is online answering our questions with respect to postpartum depression. As for this particular recording, it's quite very sensitive and very important. So I will drop the recording in a few minutes. I want as many of us to share it as far as possible to educate more men and women equally, so that we know these are the things that can happen immediate after delivery. So when things are happening, we're able to pick it up early and intervene. I just like I'm telling you, I'm currently managing somebody. She's been discharged now, but for 7 months, after delivery of her baby, her daughter, she has gone to hospital upon hospital upon hospital. But because of the way she was presenting with the symptoms, it was not picked up. It wasn't picked up early. So when she got to a particular hospital that I worked part-time, I was called, and when I went there, it was clear. Of course, it was clear to me quickly because I know what it is and how it presents. So it will be clear to you too, now that you have all the information. It's easy. As long as a woman after delivery is having certain symptoms, and they are mood symptoms, it's postpartum depression until proven otherwise. Just look at it that way. And have the person properly assessed, and then the needed help will be given. Postpartum, after delivery, and the person has some mood symptoms, suspect postpartum depression. Of course, it could be postpartum blues, but you don't lose anything if we assess the person and we say, oh, it is only postpartum blues, and it's self-limiting, which means after a few days, maximum 10 days, it will go away with adequate social support and counseling. It will go away. All right. So early seeking help is what we are asking for. All right. Early detection, seeking help, and appropriate help is what we are advocating for. All right. So since there are no more questions, everybody enjoyed the presentation. I did ask for, okay, are there support groups? Somebody is asking finally, are there any support groups who give some kind of support to people who are going through this particular issue?
Unfortunately, I don't know about any active support groups for postpartum depression. Like we mentioned, it's not a very common condition we see, so it's difficult to develop groups for such conditions. But I mean, it's something that we can look at starting in the long term. But unfortunately, we don't have any support groups for postpartum depression in particular.
Yes, that's the right answer. The truth is, mental health actually in Ghana is now coming up. All right, the new generation, we are now beginning to, push the frontier of mental health awareness creation and all that. So support groups will begin to come up, spring up all over. When people are beginning to know this is the condition I went through and I survived it, I got the needed help, so I want to help other people also out of it. That is how support groups are giving birth to. So you went through a particular ordeal, you went through it, you got a help, and you also want to help other people to prevent it and all that. So over time, once the awareness gets home, support groups will be coming out to help such people. So once again, with no other questions seen in the chat or the comment section, I want to say a big thank you to Dr. Lorna Latte, who beside her busy schedule, sacrificed her time to come spend time with us, share her knowledge and experience with us. We appreciate you, Dr. Lorna Latte. We appreciate it. And for every one of you who made time to join us, please feel free to share the recording that I'll be sharing very shortly on my status or everywhere. You can chat me privately. If you have not subscribed yet to the YouTube channel, feel free to subscribe. I've shared the link in the chat box right now. Subscribe, put the notification button on, and share the link to as many people as possible. There are lots of people who are suffering silently, especially single mothers. Especially single mothers. They need lots of help because they're the ones who lack adequate psychosocial support. Aside not having a permanent spouse or a regular spouse, they have to deal with the stresses of taking care of a newborn, and there may be financial issues as well. And they may have, some of them may have to have stopped school to attend to the child, maybe stop working or something. It's a lot of pressure, it's a lot of stress, all right? And if that thing is not done well, the child gets to suffer, the entire family also gets to suffer. We appreciate you, Dr. Latte, do you have any final words for us, please?
Thank you very much, Dr. Albert. I hope that from this presentation, we can influence the life of people around us. I guess that's the most important thing. Yeah.
Yes, the most important thing is for every one of us to know what it looks like, how it presents, and also help as many people out there who may be suffering from it. Thank you very much, every one of you. Once again, till I come your way, It's been a pleasing pleasure serving you all.
Thank you.